As we're learning more and more about the coronavirus has hit prisons and jails very hard. This morning, we're learning there are 18 confirmed COVID-19 deaths and 3 presumed deaths at correctional facilities and prisons. Today, we're going to be talking about jails, though. It's difficult to social distance, right, due to crowded living conditions, and in most cases, inmates aren't allowed to leave the facilities. There's also a lot of turnover, especially in jails, increasing the risk of exposure. Researchers at the IU Public Policy Institute Center for Health and Justice Research wanted to know more, so they got a grant from the IUPUI, to study the impact of COVID-19 specifically on jail populations here in Indiana. And joining me live from downtown is Kevin Martin, who's a senior associate at the IU Public Policy Institute. Good morning to you.
Good morning.
Hey, let's talk a little bit about this research. I want to start with why you guys felt this was something so important that needed to be researched right now with COVID.
Sure. So this was, it was a really nationwide effort that was carried out on a very local basis. And that's why we thought that it was important to study it here, but also around the country. So in an effort to reduce overcrowding, jails themselves were encouraged to review their existing populations and wherever possible to release the lowest risk and nonviolent offenders, as well as individuals who are most likely to be at the most risk from the disease, people with pre-existing conditions and things that make them particularly vulnerable to COVID.
Yeah, I think one thing that people maybe didn't understand very well here too was that if you have the workers coming in and out and you have more and more spread with more and more people, that would not only hurt the people inside the jails, but also would continue to spread COVID within the communities. What did you see worked as far as reducing the populations, and did sheriffs do this and reduce these populations in jails across Indiana?
Yeah, so from early on this year before the pandemic through the period of our study, which was about the middle of April, a couple nearby facilities here in Hamilton and Hendricks County were actually in our sample. Those saw reductions that were on the order of about 25%. That was actually a little bit higher than the reduction levels that we saw in Indiana as a whole. Those were closer to about 21% overall. And beyond that, our study actually also looked at jails from across the entire country. And Indiana was pretty consistent with what we saw in the Midwest, which again was about a 20 or 21% reduction. And then out west, the reductions were a little bit higher. And down south, they were a good bit lower, only in the mid-teens in terms of the reductions we saw out there.
We only have about a minute left. Actually, I had 2 things I wanted to talk to you about. I don't know if you can combine them, but talking about why the research, for one, is so important. And I know there are people that are watching that get concerned when they hear people they believe committed a crime, and then they hear that they're getting out of jail when some believe they need to be in. Can you talk to us a little bit about why this was so important, the research, and why letting some people out?
Yeah, so the focus here is really, again, on the lowest risk nonviolent offenders. So also from the perspective of the sheriffs, de-emphasizing enforcement of things like procedural violations, parole violations, and things like that to try to get jail populations as low as possible during this period of time, because, again, these are facilities that are very difficult to social distance, very high risk in the context of a pandemic. And this is so important to study from our perspective because, we really just want to know what worked during this period of time. This research can help local and state policymakers in the future to be able to make better decisions. Unfortunately, this pandemic is still dragging on. So of course, we need to be prepared for the possibility of a resurgence, which we all hope doesn't happen. But even beyond that, future potential pandemics in the future, we need to be prepared for that type of situation as well and how we respond.
Kevin, we sure do appreciate it. Thank you so much for being with us and explaining a little bit more about this. A senior associate at the IU Public Policy Institute. If you would like more information on this study, the research they did, what they found, fox59.com/links. Happy